Hari Om, Shri Gurubhyo Namaha, Om Dhanvantaraye Namaha. Today, the topic of discussion is back pain. Many of us suffer from back pain. Actually, WHO says that the main cause of disability in everyone's life is back pain. Most of the times, people take leave from their work for back pain. Usually, it's a self-limiting disease. What do we mean by self-limiting is when it comes, when you take enough rest, it goes off. But there is also some preventive things that you can do. Prevention like doing exercises, the right exercises at the right time. So you can do some exercises for that. There are something called as core muscle stabilization exercises. There are different stretches that you can do, and we will look into all those things. Other than that, most of these are curable by home remedies. Most of these back pains are curable by home remedies. Basically, why does a person get back pain is because he or she does not maintain their body mechanics. The body mechanics has to be taken care of properly. That is the way you sit, the way you stand, the way you do anything for that matter of fact. For example, we all know that holding the mobile straight before your eyes is actually better than holding it down and seeing it. So what are the symptoms that I have to look for when I get back pain? How am I supposed to go to a doctor? These are all the things that we are going to discuss here. Basically, the symptoms. There can be a sprain or a strain in your back. This back pain can be anywhere from behind your neck to the low back, that usually people suffer from a low back pain. So there can be a sprain. Because of the sprain, there can be a stabbing kind of pain. A stabbing kind of pain is something where a person feels as if a knife has been stabbed onto his back. Or there can be a shooting type of pain, or there can be a radiating type of pain. What is a radiating type of pain is from the low back, the pain travels as if it's going in a line through the buttocks to the thighs, to the knees, below the knees, the calves, and to the heels, and even sometimes till the great toe. This is called as a radiating pain. That is, it is continuous from the back, it is continuous till the great toe also at times. Basically, a person can exacerbate or a person can worsen his condition, especially the back pain condition, by continuously sitting, standing, lifting weights, by bending awkwardly, or many other things where he or she will strain themselves by using two-wheelers, all these kind of things. Most of the time, a person feels better when they are reclining. When they are in a reclining position, they feel it is very better for them, and back pain subsides. Usually when there is a back pain, the first thing that any doctor will advise you is a rest. A week or two's rest. In some cases, even a day or two's rest will be helpful. But usually a week or two's rest is needed. After this, usually the pain subsides. But you are not supposed to take this very easily. Usually this frequency between two episodes of back pain keeps reducing. That is, you will keep getting back pain sooner and sooner, and at one point of time you will have back pain continuously 24/7. That should not happen. So that is what we aim at. So after the rest, if you are not relieved, so when to see a doctor? As I told you, you can rest for maybe a day or two, and then if the pain is still so severe, then better go to a doctor. There are other things that you have to look for when you want to go to the doctor. The first thing is a red flag sign. That is, if you are losing your bowel and bladder control, that is, if you are losing control of your urination and passing motion, then immediately you have to rush to a doctor. If you are having a severe pain along with a high fever, then definitely you have to go to a doctor. If you have fallen down and if there is some injury, if there is some road traffic accident which has caused this back pain, you have to immediately rush to a doctor. So that is an injury induced one. Sometimes there can be a back pain which is suddenly getting very acute, suddenly it gets very severe, then immediately you have to go and visit your doctor. As I told you, there can be a radiating pain, especially if this radiating pain from the back, if it travels through your buttocks to the thighs, and if it travels beyond your knees or below. Definitely if it crosses the knee and if it travels below, then you have to visit your doctor. Other than this, you can see various symptoms like weakness, numbness, tingling sensation. Even when you are not wearing slippers, you will feel as if a layer is there under your sole because of the numbness. It is called as paresthesia, altered tactile perception. All these things when you see, definitely you have to go and visit a doctor. All back pains can be divided into two. One is an acute one, which is having a history less than 6 weeks. Another one is a chronic one, where the history is more than 3 months. So let us come to the causes. What are all the basic causes that can create a back pain? Firstly, as I told you before, there can be a muscular or a ligament or a tendon sprain. Because of this sprain, using some part of the body awkwardly leads to a sprain. So if there is a sprain, there can be pain. So awkward movements will create this problem. Other than this, we all know very commonly a word called as a disc bulge. So in between two vertebrae, that is the bone which is there in the back, that is usually people call it as spinal cord in colloquial terms. Actually spinal cord comes from the brain, but the vertebra is actually the bone. So in between two vertebrae, if the disc which is present in between them is under strain because of the joint space reduction between these two vertebrae, or because of some injury, if this disc is under some strain, then it will get bulged. This is called as a disc bulge. Other than this, there are various levels of other problems. After a disc bulge, there can be an annular tear, a tear in the disc, or there can be other types of arthritis. And arthritis is something where a person gets pain in the joint. Like how you get knee joint pain, you can even get pain in the back. This is called as osteoarthritis. There are also other types of arthritis which will create back pain. So osteoarthritis is one, rheumatoid arthritis is one. Other than that, the age of the person, if the person is an old person, a senile person, definitely there can be back pain. If the lady has undergone menopause, that is her monthly cycles, period cycles have stopped, that can lead to calcium deficiency later, and because of this she can have back pain. It can be an injury induced one because of falling on road traffic accidents. There is a lot of connection between using epidural injections during deliveries and severe back pain after that, lifelong back pain after that. Mind you, this can be cleared very well with Ayurveda. And basically this there is a theory that people will get back pain especially in their middle ages when they are between 30 and 40 because they are very active at that time. But very recently, last week also, I have treated a 17-year-old boy with a very bad back pain. And some maybe 3-4 months back, or maybe even before that, we have treated another girl who is still in her schooling with 3 disc prolapses in the lumbar area. So, these things actually crop up nowadays at a very early stage. Other than this, the other causes are skeletal irregularities. What is a skeletal irregularity? The vertebrae have to be stacked up in a specific alignment. Okay, the neck vertebra have to have a lordosis. That is, they should have, when you see from behind, they should have a concaval curvature, and the thoracic vertebra, or just behind the chest, should have a convexal curvature. Again, in the low back there should be a concaval curvature, if this alignment is lost, or if the alignment is not straight, if it is bent to any one of the sides, or if it is bent to the forward side, then it is called as a scoliosis if it bends onto the side, or it is called as kyphosis if it bends onto the front. It's called as kyphoscoliosis if it bends both onto the front and onto the side. There are many skeletal irregularities which will create back pain. Other than that, there is also another condition called as osteoporosis, where the calcium deposition in the bones can become very less. If the person is not exercising properly, that can lead to continuous back pain. If the patient is obese, that can lead to back pain. Other than that, if the patient is having some medicine from some psychiatric doctor, that can also in the long run create back pains. It's a general side effect of that. Lifting weights with a very wrong technique, that is bending forward and trying to lift very heavy things, will definitely create back pain. You need to put the pressure on your knees and then lift it. We all have seen in the TV how weightlifters lift weights. They put the stress on the knee and they keep their back erect. That is how you are supposed to do it. Other than this, smoking is one of the major causes of back pain, because the person who continuously smokes risks the problem of not having proper blood supply to the lower part of the back, what we call as lumbosacral area. The blood supply becomes less, and in Ayurveda we call this as Vata Vriddhi in Vata's own sthana. That is, nourishment basically is very less in this area. So when the blood supply becomes less, obviously nourishment becomes less. When nourishment becomes less, obviously there will be back pain. So how to prevent this back pain? First one is, the correct set of exercises must be done by the patient daily, and this correct set of exercises in a healthy man is the same thing, but when you have some back problem already, then this is highly tailor-made. So you have to consult your doctor or your physio to know what kind of exercises you can do. Other than this, generally you can go for a walk or a swim. That will help you to prevent back pain. Mind you, this will prevent. When you're already having a back pain, don't go for a swim. Once that episode of back pain is over, then you can go for a swim. The core muscle stabilization exercise that I was talking to you before is very important. We even have some other person's YouTube videos which will help you in core muscle stabilization exercises. But don't go to do exercises with videos. Consult a doctor. Let the doctor advise you or a physio advise you. That would be better. Definitely you have to stop smoking or drinking if you have that habit to get relieved of long-term back pain. And you have to stand smart. What is standing smart? Never slouch. Always sit erect, stand erect. That is very important. A good posture is very important. And there is something called as a good posture technique. When you're standing continuously for hours together, if you're able to put one leg on a platform or a small stone or a stair for that matter of fact, so one leg should be above and one leg should be below, with one of the knees bent slightly. Then after some time you can alternate the legs. This is called as a good posture technique. Always use hard cushions on the chairs that you sit for the low back. This also prevents back pain. It is better to use swiveling chairs rather than using a hard chair. Usually that is very useful. So these are basically the things that you can do. Other than this, one very important thing that we have already talked about is, when you're going to lift some weight, always lift it with a strain on your knees rather than putting strain on your back, especially when you're already a person who's having back pain. There are different levels of this disc pulse that we were talking about. When the pressure in between, when the pressure that two bones exert on the disc that is in between increases, the first level is called as a disc desiccation. This disc can get degenerated when it is very chronic, or later it can become a disc bulge or a disc annular tear, or there can be protrusion of the disc, there can be extrusion of the disc. or lastly there can be a sequestration of the disc. There are also various grades of protrusion, sequestration and all that. But in Ayurveda, we can treat people until the person has a disc protrusion or an extrusion, not beyond that. If it is a sequestration or a very bad extrusion, usually the only way to treat it is a surgery. Otherwise, in Ayurveda we have excellent remedies for this. So when you have this kind of a disc bulge or a disc prolapse, then it slowly goes posteriorly, that is towards the back, and it touches the spinal cord. The spinal cord comes directly from the brain. It is made up fully of nerve tissue. So when it goes and touches, or when it intends on the thecal sac, or when it goes and touches the spinal cord, then the exiting nerve root from that place will have a strain on it. So wherever this nerve travels, in all those places there will be pain. So that is why the problem is actually in the back, but the whole leg pains, because that nerve is under stress. So in all these kind of back problems, always for prevention, one more thing we forgot in prevention, never sit on the ground, never lie down on the ground, always use western closets when you're having back pain, and make sure that you don't have any constipation. Constipation actually worsens the problem. Lifting weights, make sure that you don't lift weights. Before lifting a weight, you think twice or thrice whether you definitely have to do this, and so other things which we have already talked about. There are various types of treatments that we can give in Ayurveda when it comes to back pain. We give massages. Not in all cases we can do massages, although very crudely when we say treatment we can do massage techniques. But not in all cases you can massage, especially in disc prolapses you cannot massage the person. When you massage, most of the times you end up worsening the problem. So if you have a back pain, better go to an Ayurvedic doctor for getting a good massage rather than going to a massage center. And we have other treatments like Dhara. In stress induced disorders, I have talked about Shirodhara. This Dhara is the same Dhara with a different set of medicines. We can do it on the low back, or in the middle of the back, or in the neck, wherever you have problems, wherever you have disc bulges. Basically, other than this, we also have something called as pichu, where hot oil is soaked in a cotton cloth and then it is kept over the place, or a cotton piece for that matter, and it is kept over the place where there is pain. There is something called as a Sthanika Basti. We make a small round around the place of area of pain. If the pain is very centric, very focused to one place, then we make a round shape around that with urad dal, and then we pour warm oil into that place and we allow the warm oil to stay. There are other techniques like kiri. When you want to administer hot fermentations, then you can give kiris. Kiri, there are different types of kiri. There is Patrapotali Svedam, there is Jambira kiri, there is Navara kiri, there is Podi kiri, depending upon whether there is inflammation, whether there is more pain, many other things. And one standalone treatment again that we use here is Basti, because the nearest route to the back is the rectum. So a transrectal administration of medicine is given. No pain absolutely when you are giving these treatments. Actually you will feel like you are in a spa, being massaged, being poured with oils and all that. So the treatments are actually very soothing. They also calm the mind. They also help you in getting rid of this back pain by giving more strength to the tendons and ligaments around the vertebra. And because the tendons and ligaments are strengthened, then the vertebrae are pulled far enough to give the disc enough space to come back into its own place. This is how we treat. And in the long run, when we keep giving medicines and when we keep doing Panchakarma techniques, there is also a cartilaginous tissue formed over the prolapsed disc, so that the disc doesn't get prolapsed any further. So this is how Ayurveda treats. So if you have back pain, any type of back pain, don't be afraid. Approach us. We are here to help you at Bharat Clinic and Viva Ayurvedic Center. Thank you.